If you're experiencing a gradual onset of deep buttock pain, then this video is for you. If your deep buttock pain came on gradually when sitting or with sitting, then it's most likely that you've got upper hamstring tendonopathy. Let me explain what that is. So your hamstrings, the tendons at the top which attach to your bum bones, that's part of your pelvis known as the ischial tuberosities, at this point the tendons can become sore from pressure or too much tension. It could be exercise related or related to certain postures that you've been holding yourself in, for example. So in this video, we look at how to manage pain from this point here, which commonly presents as deep buttock pain when sitting. Now, if you have experienced sudden pain at this point, it may indicate a rupture, so make sure you get a professional medical assessment. Also, if the pain goes down below the knee, it may indicate that you've irritated your sciatic nerve. So once again, make sure you get a medical assessment. This is just an educational video. We hope it helps, and it's for people that have had a gradual onset of deep buttock pain. Let's move on. My name is Daniel Lawrence, UK physiotherapist and licensed healthcare professional. Welcome to the Physio Channel. So the condition we're talking about, this upper hamstring tendinopathy, occurs here at the top of the hamstrings where they attach to the bum bones. So if you were to put your hands on your bottom, you'd feel those bones there. And if you were to sit on your hands carefully, you'd feel those bum bones in between the chair and your fingers. They're your ischial tuberosities, part of your pelvis. And it's pressure through the hamstring tendons and those bones that is thought to cause this deep buttock pain. So what can you do about it? Well, here's the first thing. You can reduce the deep buttock pain by having a look at your sitting position. So if we take here a typical office chair, there's a few things you can do to reduce the discomfort, reduce the symptoms, and hopefully help with the recovery. The first thing is this: increase the chair height so that your hips are above the height of your knees. As you can see, this chair is a little bit low. So increasing the chair height will help. Having your hips higher than your knees is what you're aiming for. Next, hopefully your chair has a tilt function, which will tilt the seat forwards, taking some of the pressure off those bum bones. Now, it might seem a bit counterintuitive, but sometimes sitting up too straight can put more pressure down through those ischial tuberosities, more pressure compressing on those hamstring tendons. So actually it can be helpful to lean back a bit, not too much, but just a bit, and that can put you into a more comfortable position, reducing the chances of that deep buttock pain troubling you and hopefully reducing the symptoms. The next piece of advice if you're suffering from deep buttock pain is to purchase a pressure cushion. I'll put some other examples on the screen here and a link in the description. Now, these cushions are used by people that spend a lot of time sitting during the day, such as in care settings or wheelchair users as well. They can make a huge difference if you're suffering from deep buttock pain. So don't hesitate to have a look at one, and don't hesitate to consider purchasing one. Again, there's a link in the description to show you a few different options. Next, let's consider the potential causes of this problem. Aside from prolonged sitting on hard surfaces, it is thought to be caused by prolonged bending and prolonged hinging on the hip. So in positions like this, for example, not just one-off or for short durations, but repetitively or sustained in this position. So non-athletically, this may occur from prolonged housework, come back up again now, or lots of hours in the garden spent in that bent over position, especially if you're favouring one leg. So you're bending over and favouring one leg over the other so that there's more strain going through one hamstring tendon. That can certainly bring on the symptoms on one side. And athletically, it can be caused by lots of hip hinging exercises, perhaps lots of glute exercises where you've got this repetitive bending and repetitive strain on the tendon. Let me show you what happens in a very simplistic sense. Okay, so imagine my fist was the ischial tuberosities, and this red band represents the hamstring tendon. That tendon is not only pulled tight, but it's compressed against the ischial tuberosity, which is why sitting can cause the symptoms, because you're directly compressing, but it's also why sustained bending at the hip can also cause the tension and compression, and can be one of the causes of these symptoms. It's because of the tension and compression mechanism. So what's the solution? Well, instead of sustained bending at the hip, either in the house or the garden, for example, make sure you bend at the knees instead, going down like this, or if that's difficult, go into a split squat position and go down like this in order to do tasks low down. That's the first bit of advice, is to try and bend more at the knees rather than just at the hips. If it's exercise related, such as the hip hinge, I'll show a picture on the screen here of the hip hinge exercise, or some kind of straight leg deadlift hamstring type of exercise, then switch to some bridging exercises where the hips are in a more neutral position and you're focusing more on hip extension rather than hip flexion. This is the best exercise to help with the management of that upper hamstring tendinopathy, to help with the management of that deep buttock pain. It's called the long lever bridge, and there's a demonstration going on right here. So you're lying on a firm, flat surface. Make sure you're comfortable. Have your feet up on a raised surface. We're using a small stool here with a cushion on top for comfort. And then our patient has their legs out straight and they've lifted their hips up to create a human bridge with their legs out long. Shorten the lever, lift the hips up, and this is a great exercise for the glutes. You've probably seen this one or done this one in a Pilates class. So the short lever bridge is a brilliant exercise. You could add that one into your program, but the one which targets the hamstring tendons and that deep buttock pain more is the long lever bridge. So we'll go back to that one. A couple of ways you can do this. One is to go up and hold the position for 1 minute. These are the static holds, the isometrics. After 1 minute, come back down again, rest for 2 minutes and repeat that 1 minute effort 2 to 3 times. Or instead of holding it for 1 minute, you can go up and down, in and out of the bridge position, slowly and under control for 1 minute. Then have your rest and then again repeat that 2 to 3 times. You could do a mix of static holds and slow movements, but make sure the movements are under control at all times and you're not moving too quickly or flailing around. Then if you want to make it harder, cross the legs over, so you bias the effort onto one leg. That will make it a bit harder on one side. The more advanced option is this. Lift one leg up in the air and then lift the hips up using just the remaining leg. And this is the more advanced option, targeting one side. So naturally, if you're doing both, you're going to have to do the repetitions on one side and then on the other side as well. So that will take you some time to do 1 minute times 3 on both legs. That would be quite difficult, but there's some advanced options for you. So they're the best exercises for dealing with the condition. Choose one of those that's appropriate for your current level and have a go at performing those, and you should notice a reduction in symptoms. So in conclusion, to help reduce your deep buttock pain, reduce those aggravating factors, that prolonged bending, exercise choices, sitting position, and consider those pressure cushions as well. Then do those exercises, or that particular long lever bridge exercise that we showed, that can help you to get on top of the symptoms. You may also find a bit of massage helps as well. There's a video showing on the screen here of some simple ways to massage the hamstrings. Hopefully you've given this video a like. Thanks for watching. Share it with anybody who you know who may also be suffering from this deep buttock pain, and we'll see you in the next video.